Chronic Illness Therapist podcast. This is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. Hey everyone, it's been over a month since I posted my last episode, and I'm really glad to be able to get this one out. This year, my goal is to hopefully get episodes out once a week, but that is quite an ambitious goal, and it might not happen. But I do want to at least be able to continue doing every 2 weeks. So definitely be on the lookout for that. And I'm also starting a new membership for people who are just kind of looking to learn the basics of acceptance work. What does it mean, and what skills can help you kind of lean into acceptance? You know, we talk a lot about acceptance on this podcast and what it is and what it isn't. So I won't repeat that all here. But if you'd like to sign up for this membership, I'm still kind of figuring out exactly what it's going to entail, but I know it will at least have videos, training videos, and a transcription with each video, as well as like some worksheets when applicable. And eventually the goal is to have a community where, you know, people can chat with each other and kind of like a Facebook group, but I don't think it'll be on Facebook. I think it'll be on a different platform. So I'll keep you updated on that. If you're interested in learning more about that as I learn more about it and exactly, you know, what it's going to be, then sign up for the email list, and the link will be in the show notes. And yeah, I won't spam you with lots of emails, but just updates about what's going on in the membership and what it all entails. So thanks. Jennifer Hama has been practicing as a professional counselor since 2007, and she's been supervising clinicians since 2010. She's worked with patients with a variety of chronic illnesses at all levels of care, including inpatient mental health treatment centers, as well as outpatient centers. In addition to her professional experience, Jennifer's also a spoonie in her personal life. Her professional and personal experiences have led her to develop a meta-theoretical model, which she uses with patients and supervisees. And she's currently developing this model into a self-help book that'll soon be available. Jennifer is an undercover geek, hiding in her nerdiness only minimally, with too many fandoms to name. Her spare time is spent being geeky with her family, which includes her spouse, her 3 kiddos, and their Bouvier de Flanders named Dean. Jennifer, hi, welcome.
Hiya.
So tell me, you've been practicing since 2007.
Mm-hmm.
When you have had your own private practice since then, or what's your history with practicing?
So I did a lot of work in 2007. I went and worked straight for my the place where I did my internship, which is a big psychiatric hospital. You probably have heard of it here in Atlanta. It's like one of the largest in the Southeast. And so I grew up there, so to speak, and did lots and lots of different jobs there, and really enjoyed my work for the most part. It's a lot of like new things. It's not the same day each and every day, all of that good stuff. So I stayed there for about 10 years, and I ended up, you know, being a director of a couple different programs, stuff like that. And I had started a small practice during that time before I took the directorship. And then when I took the directorship, I was like, I cannot do both. Nope. And then when I was starting to get burned out there, so I slowly slept down. I started a family, so I slowly stepped down after I was director and worked there. Thankfully, I was able to work into like a part-time position where I had insurance, which as spoonies, we know that's a tricky territory. So I like had insurance, which was really nice, and then ended up like having to leave. There was a patient incident. I was like, I'm done. I can't anymore. I'm over this. So I ended up leaving, and I was working with someone who owned a private practice. And I was like, you know, can I like come on board? And they were like, yeah, sure. and I ended up staying with them, still with them. The practice has changed like multiple times. So I legit have like the best gig in the world. I like show up and do therapy. So I don't own the practice. I'm so thankful to the practice owner. If she listens to this, thank you, Mari. And she gets to do all that, because I still have nightmares about like scheduling, just hospital PTSD. Like, nope, I want zero part in that.
Yes.
I'm glad to consult anyone who wants feedback on that. I'm glad to give it. I just have zero interest in implementing any of it.
Yeah. And just to be clear for people who maybe listen to this, the nightmare doesn't come from the patients when you're working, and
No,
it's
not at all.
It comes from all the admin, lack of support, and politics and things of that nature.
Yeah. And I still say, like, of all the organizations, like, I do believe my hospital like did it best. And absolutely, like, it's just, it was really, and it was, again, like that sort of lack of support. The patients are very ill, it happened to be targeted at me, but like, again, like there was that like lack of support where like I can't, I had a very strong, immediate, acute traumatic response, which was a little bizarre, kind of being from like the book reader seat to being in the real seat. I'm like, oh, this is what this is. And so I just wasn't able to make it back after that.
It makes
So,
sense.
but yeah, that's a great clarification. It has nothing to do with that.
No. Yeah, it's tough. It's a tough, agency work is really tough, but you do learn a lot, and there's a lot that's rewarding about it, but it is very, very tough.
Absolutely.
And I think you do it for an amount of time. I don't think it's a job you're supposed to do for 30 years,
I like some folks, the longest I had heard, I always joke that you would be a veteran after 5 years. So if you worked in hospital or agency, 5 years, like you're like the oldest one there, you've been working the longest, you're the most like jaded. And so like 5 years is about it. But I knew some folks who worked, 20, close to 30. And I was like, dang. Like,
oh man, as therapists or
as therapists.
oh man.
Yeah. I guess technically one of them was a nurse first for the first half of their career and a
Oh, wow.
therapist for the second. But yeah, so I was like, that's, and they knew what they were doing. They ran their ships tight. And so that was kind of nice. But
Yeah, you learn, I guess if you stay there long enough, you learn the system and you learn how to make the system work for you. But if you can't, then
and to this day I miss it, because it's just it's just very bonding to the people that you like work with. And so like I'm still very close with a lot of folks that I like worked with. Like I'm meeting, a lot of like some of them on Friday, like we still like touch base, and and just being able to connect that way. But also you get to serve a lot of people, because very unfortunately that is like the first time people interact with the mental health system, which, oh my gosh, I'm so sorry. And
like once you're already, if we could get you help and support way before you reach a level where you even need intensive care, would be great.
Absolutely. And that's also where, I just ran into, I didn't at the time identify as someone with chronic illness. So even though technically that would fit, I think you might sort of relate to this. It's kind of like when you get all that medical gaslighting at the beginning. So I was just like, okay, I guess it's like all in my head, and I'm just gonna keep on rocking. But then that was really my sort of like my first intro to folks that were struggling with chronic illness, because they would come in and they would also have other things going on, like it could be like a comorbidity with something, but also like they would have chronic mental illness. Again, I don't just to distinguish the difference, I don't technically believe there's too much of a difference, but like medical versus mental health. And so I would see that a lot, and I would get sort of I would get what they were going through, even though I couldn't quite cross that understanding for myself yet. I would say very recently in the last year or two have I really started to acknowledge my identity as someone with chronic illness. And so, but being around that, I got to understand a lot of like how the interactions would happen, how we would have to accept some things that we didn't want to accept. And which is the big lesson. If I'm working with someone with chronic illness, that's the big lesson that I'm like, we can be pissed about it, like as long as you need to be. I got zero qualms, however long we need to take. And we've got to accept the unacceptable. And that's kind of where I see the most benefit, or where I like to work with folks. Because again, we don't, it's really unacceptable. And yet it is what it is, unfortunately.
Yeah, I definitely relate. It took me a long time to get a diagnosis, and I was like anti even looking for one. It was my own therapist, I've mentioned this on the podcast before, who was like, I really think you need to go get checked out. You need to, I'm like, no, like doctors don't do anything anyway. So.
Sorry, I'm pointing at you,
Yep.
like people can see me.
Yeah.
I'm like, yeah, absolutely. Sorry, continue.
Yeah, no, it's true though. I mean, that's been my experience. I've learned through working with chronic illness folks is that isn't quite the experience. Of course, no, not everyone has the same experience. Some people have the experience of like going doctor to doctor to doctor and trusting them for the answer. And I'm not saying that one way is right or not, but I've always leaned towards like, I don't want to be gaslit. I watched my mom like my whole life kind of grow up with no answers and just like said it was all in her head. And so it was even interesting because when I first started looking for when I first got a diagnosis and I realized like, dang, yeah, I've actually had chronic pain for like the last 8 years. But it wasn't never that I had my own trauma with doctors. It was that I had my mom's trauma with doctors and I didn't even know it.
Yeah, now that you say that, I'm like, because I've got an illness called endometriosis, which does have some genetic piece to it. And so it like multiple women in our family all told these things. Even now they'll tell me things, and I'm just so, thankful and lucky that I have like a good doctor that happens to be in here, like in the Atlanta area, that like actually knows what he's talking about, because most doctors don't. And like they'll still hear like the same stuff, and I'm like, like no, that's incorrect. But yeah, and same with like my mom. I didn't put the two together until you had just said that. But yeah, just nothing really like helps, and they get gaslit, or they're told, you're just, you can't tolerate pain or whatever nonsense.
Yeah, you're being dramatic, or you're a hypochondriac. I mean, yeah, it's
all of the above. So so definitely like starting to, and I think internalizing some of that was part of my journey, very unfortunately, but want to be transparent. I think I was like harder on people because of that, and I think that has done, to accept that I've done some damage because of that, because I was like, I'm working through all of this, like, why can't you?
Yeah.
And so having to just rework that for myself, and being able to say like rest is important, like that one is still a little hard to like swallow a bit, and to be able to like get with those things. But that's been a little bit tricky, and sort of challenging all of that internalized ableism.
Yes. Especially when you're a mom, because obviously in this country, there's no free childcare. There's no support system. There's no care for, in fact, there's a movement of like, just if you have kids, that's your choice. You like, you deal with it. It's like, oh,
right. Right. It's like, oh, we're going to be like, oh, so happy for you, but you don't want help.
Yeah.
But I'm not going to help you.
Exactly. Yeah. I feel like right as I was starting to learn the lesson about slowing down, like, bam, I got pregnant. And then I was like, oh, slow down. That's not even an option anymore.
Right. Absolutely. I had different experiences. One of the big myths with endometriosis is that like, just get pregnant and it'll go away.
Oh, yeah.
And I was very, very lucky. Again, not a doctor who specialized in endometriosis, but who was like really on top of the infertility game. So I had infertility with my first one, and was able to get pregnant via IUI. And it was great. Like when I had the pregnancy, like when I was pregnant, I was like, oh, that's when I really started to like click, something is wrong here. Because I was like, I feel fantastic.
Mm.
Like
Which
this
I've
is,
heard people with autoimmune, and I felt better too when I was pregnant, but I had just started feeling better right prior. So, but
yeah,
anyway, yes.
like who knows,
Yeah.
right?
So it's interesting. Your relaxing, your system, your symptoms going away was like this
Yeah.
thing. I was like, whoa, this is different.
I was like, oh, is this how people feel? Oh my gosh. And then like, but right after I was done being pregnant, sort of set off this like cascade of health issues that, and then I've got 3 kids, and each subsequent pregnancy was like worse and worse and worse.
Mm.
And so like but I got a hint of it at that first pregnancy. I was like, oh, this is what people feel like when they're like, their body's not like attacking itself.
Yeah. And remind me, did you got your diagnosis after you
I
got,
did.
okay.
I did. I got my diagnosis actually a year and a half ago. So
Okay.
this had been going on since I was 13,
Wow.
13 to 41,
Man.
however many years that is.
Yeah.
So like 23 or so.
Yeah.
And brain fog also another
Yeah.
symptom. I can't do math right now. So yeah, so it had been a significant period of time, multiple doctors, multiple ER visits, and thankfully with this doctor that I have, he's like, there's a bit of a trifecta of illnesses that occur at the same time. And so you can have like, I also have diabetes. And so I have to manage like these other ones in order to manage the pain. And so it's very helpful to like one, have a doctor. Like this is what I tell my patients too. I'm like, your doctor doesn't have to agree with you, but you do have to believe that your doctor understands what you're saying. Like, so they don't, he didn't have to agree with me, but when I had a surgery to fix it and to remove a lot of the adhesions, and he was like, I don't think it's endometriosis. He was like, but I do think it's like inflammation and the pain is there. And that was just so nice to just hear someone say, like, I'm so sorry, like that hurts. And I'm like, thank you. Like, cause I'm not
Yeah.
like making this up. And my pain was like so much better. I was still just having pain like, once a month. Oh, and so
Yeah.
I was like, I hate even complaining about this because my life is like 90% better, but it's like significant. Like I can't move. And again, just that like that pain tolerance that you develop over so many years, you're like, oh, okay.
Yeah, exactly. When you have to work through the pain too, going back to just living in a society that doesn't really care about anybody who like can't push through it. That means there's no resources and no
Yep.
support when you're down and out.
Yeah, I think the last I had looked, there's like 50-ish endometriosis doctors in the States.
Wow.
So the chances are, this is a part of my thing. I like to educate people. I'm like, listen, like chances are the doctor you're speaking with does not specialize in endometriosis. I've had doctors tell me to my face the absolute wrong thing about it. And, in that moment, I couldn't challenge them on their like erroneous beliefs. One, there's a power differential. Two, I didn't have the spoon or the energy to do it because obviously I wasn't feeling well when I was seeing said doctors. But yeah, just like a lot of gaslighting, and all of that to be able to like, get people to the right place, I think is a bit tricky. I imagine that was part of your journey as well, where your therapist,
Yeah.
not trained in medicine.
Yeah.
I'm assuming.
No. No, but she herself had Ehlers-Danlos syndrome. And so she thought that I might have that just from some of my symptoms, but I don't think I do. I have a little bit of hypermobility, but nothing really diagnosable. That's actually been all of my symptoms and all, like, it always feels like I'm just on the cusp of like a diagnosis of something. And then it doesn't quite meet criteria. And so I think that too is like where some of the gaslighting comes in, because I mean, in mental health too, it's like addiction, right? Typically, I mean, now I think there's a lot more therapists working with like sober curious and instead of like But before, it was like you either had addiction or you didn't.
Yeah.
And if you were just like binge drinking every weekend and it wasn't affecting your work and your life, but like it was still something you couldn't really change, you really did need help for it.
Right.
Again, you weren't addicted, so therefore there's no help for you. And I feel like that's kind of, that's how it is. Same thing with diabetes, same thing with,
Yep. Yeah, because the same thing with like diabetes, where people will describe some symptoms to me. Type 2, there definitely a difference with type 1. And so like people would describe some of that and they're like, my doctor says like I'm not diabetic. And I'm like, was this the fasting test? Did you spend 3 hours drinking like this awful, disgusting Gatorade? Then you didn't. And I'm like, I'm not a doctor. And yet I'm like,
Yep. And that's where we come in, right? As therapists. I think this is something we talk about. I've talked about this a lot, but maybe not in this level of clarity. Like our role of being therapists who specialize in chronic illness is not to treat the disorder. It's obviously everyone kind of understands the managing stress piece of it, but it's also about helping you find resources and doctors and answers by here's what to ask and how to ask and when to ask.
Yes, absolutely. And one of the other big things too, I think is to be able to so one of the things that I do, me and Nadia Clance Davis, who's also here in Atlanta, air quotes, up in Swanee, her and I put together the CE for other therapists, like ethics and competencies for working with people and persons with chronic illness and pain. And that was one of the things, is sort of that like no diagnosis is good enough. Like meaning, so no diagnosis. If there's not like a title there, that's fine. Title doesn't matter. It's helpful for you in a sense that it's easier for us to accept, right? Going back to that acceptance piece, like having that name is helpful for us to be able to put like an understanding with it. And yet I don't want people to put off acceptance for lack of a title. And like you were saying, when we go in with doctors, a lot of times they want to have that check box. Then we can like be able to like, if we allow this sort of like discussion, to be able to say like these symptoms, like just because like it's not like matching what's in this little box set, it doesn't mean that it's not happening. So doctors will like try to put into this box, and I'm like, the body is much more complex than that. And again, if my patients can't explain to me what the doctor is describing, the doctor didn't do a good enough job. Like, I'm sorry. Like, and I know how hard it is to explain to folks like medical. I consider it a whole different language, but you have to be able to explain at that level. Like that just has to happen. If a patient doesn't understand their diagnosis, that unfortunately is on the provider to be able to explain why or why not, which again goes to my thing of like, if the doctor doesn't have to agree with you, but they do have to like be able to explain it to you, or you at least need to believe that they're like listening to you. And understand you, because that's what we do as therapists, right? Reflective listening. Is this what I hear you saying? Okay, so you're concerned that this pain is related to this. Here's why I think it is. Here's why I don't think it is. And like lay it out. Like I don't know if it's because of our therapist training. I'm like, I don't feel like it's that hard.
I feel like, I think this the same thing. I'm like, like whenever I start to go down that train of thought, I'm like, give them slack. Like they literally weren't trained in this. But then I'm also like, shouldn't like a course in motivational interviewing? I mean, motivational interviewing is literally.
Oh, motivational interviewing is like glorious. I don't know. Do you know Dr. Bethia Walsh? She's here in the Atlanta area. She's a trainer for MI. She's great. If you ever get a chance to take MI, like the doctor should take an MI course with her.
Yes.
It's so like wonderful. And they've done some research. This was on I think it was the Adam Grant podcast. They were talking about burnout. Yeah, they were talking about burnout with doctors. And burnout does lead to lack of empathy. Again, like hospital agency systems, right? We understand this. And they were like, one of the best ways to like get back in is to connect back with that empathy, that motivation for people to change.
Yes.
And so, so
it's funny as you just said that. I'm like, but doesn't lack of empathy lead to burnout.
It's such a, like, is it cart, horse?
Mhm.
I don't know. It's definitely like one of the things that, working in the hospital, I was very familiar with, like the science of burnout. I help people now that are professionals, like work with burnout. And it's definitely one of those things where it's like, do I stop caring because I have to save myself? Because if I continue to care in a system that doesn't, like, that's
Yeah.
dangerous. It's
Yep.
sort of like if you're in an unhealthy relationship, continuing to care is unsafe. And
Yeah.
so it's a really interesting paradox that you're bringing up. Like, wasn't it there? Isn't that the is
Yeah.
that the symptom? Who knows?
I know. I know.
I'm sure.
Yeah. Learning to talk with empathy and compassion and paraphrase correctly and summarize correctly, it is a skill. It does take time to learn, but the research is clear. I mean, as therapists, we all know that goodness of fit, like personality, is more important than your theoretical orientation. But what I was surprised to find was that there's actually been research done with medical doctors too, that the relationship between you and your doctor will help you fare better and have better health, physical health results, just because
Yeah.
you had a good relationship with your doctor rather than like going to the best specialist in the world.
Yep. Yep. I really liked the Netflix show, Lenox Hill.
I
I
didn't
don't know
watch,
if you
somebody
saw.
just mentioned that to me like a week
Yeah,
ago. What is that about again?
they're two, I believe they're oncologists specializing in gosh, it's been a couple of years since I've watched it, but I actually took a CE with them. One of the CEs in Georgia had the doctors on, and we got to like talk to them and stuff.
Cool.
But like one of the things that I really liked about it, I'd written a blog post about it. Like one of the great things about that is like they really did like connect with their patients, and they connected with them emotionally, and they also had a lot of laughter. I am like the queen of sarcasm and dark humor, and also too soon and need to be told to too soon, Jennifer, and I will accept that feedback graciously all the time. But like that's one of the things that I really saw about that, because we are talking about cases like there is not recovery. It's about that quality of life, which I think is so incredibly important for us as clinicians too. One of the things when I'm working with folks at the hospital, there's a lot of folks where it was just chronic, like that was the illness, that was going to be it, whether that was schizophrenia, whether that was a bipolar illness, and then sometimes like depression, anxiety last throughout the lifetime. And being able to just sort of accept that this will continue, but we can give you a good quality of life, I just think is so important. And recognizing that having fun and laughing and enjoyment, is a part of that, being able to like add that to your life. And yet sometimes ableism is like, well, if you're able to have fun, you're not that sick. It's like, okay, so I should be miserable 24/7 in order to make
Yeah.
you believe me? No.
Yeah. Yeah. And we get caught up in that so quickly, not even consciously, but we learn, oh, people respond to me with more belief when I am sicker. Therefore, I believe this is a really tricky conversation because it can sound like you are making yourself worse. And I promise
Yes.
that it's not the case here. But I really do believe that when you get basically positive reinforcement for being sick, in other words, people believe you when you're really, really
Yes.
sick, your
Yes.
body literally sends signals to the rest of your body saying, hey, this is how we get what we need. And
Yes.
it literally makes you physically sicker.
Yes. Yes, absolutely. Absolutely. And then that sort of ends in, again, not as a judgment. Like we want to be seen as humans, right? That's sort of like a core fundamental thing. I
Yes.
want to be believed for my authentic self, which is currently in pain. And so like that is one of those things where I'm like, you just got to like go in with that, because the consequences are more devastating, unfortunately. And so we have a hard time with that as a society, where like I don't want to give attention to things. Like we do this to kids, right? They're just doing it for attention. I'm like, of course they are.
That's, yeah, literally what their body needs. in their
Facts.
minds.
Hashtag facts. That's what they're doing. We need attention from people.
It's so true.
Like that's not a negative thing. And
Yes.
so like if I'm going to someone with a pain that there's like concerned about, like why don't you just start with, oh my gosh, like that pain is there. I bet that's like a really difficult experience. Like I'm a therapist who used the word should and awful. I that shouldn't be there. That's so awful. I'm sorry.
I absolutely use those words too. I have
Right?
I have a pet peeve with we'll deviate a little bit, but a pet peeve with therapists saying like we shouldn't use should. I'm like, you're literally saying should in the sentence.
Yeah.
Anyway, yeah, no, connection, right? Or we're saying attention because that's the word that gets everyone, but
Yes.
it's about connection.
It
And
is.
it is. It's a human instinct.
Yep. Yep.
And your pain, the research shows your pain physically is better when you feel socially supported.
Yes.
And so then people will be around their friends or their family and they'll be feeling good. And they're like, wait, why am I feeling good? Like, does that mean my pain is in my head? Oh my God, they're all right. They're right. It's in my head. And
right.
you spiral. And then you're like, then you isolate and then you feel bad again. And you're like, oh, see, okay. And it actually keeps you stuck.
It's such a nasty cycle. It is such a nasty cycle because, and again, like, if we think about the mechanisms of gaslighting, right? Gaslighting is used as a perpetration of violence, right? So not to go like super dark here, but I'm going like, right? Those are the things that like war, like victims of war have like experienced or prisoners of war have experienced, right? If we go back to like Judith Herman's book on trauma, like gaslighting is a way to like make the person feel unstable. So we see it in relationships of violence, like intimate partner violence. We see it with like prisoners of war. We see it in these other like unhealthy relationships that maybe folks don't want to use that term violence with, right? The whole gamut. But what it's doing, it's creating that sort of unstable foundation within the self too. And so that unfortunately creates this dynamic that I want to kind of come in and change, to be able to say like the pain is there whether or not you believe it. Whether or not it's anything urgent, I don't know, maybe not, right? But I know that the pain is there. It is valid, whatever the reason. And I would really love some medical people just to say, yeah, I don't know.
Yes.
Don't know.
We've definitely talked about this conversation on the podcast. Like, do you know how much world of good you would do to just say you don't know?
I don't know.
So you come in with this authority, like you know all the answers, but you actually don't. It just perpetuates that gaslighting. It's yeah.
I appreciate this sort of like want to put in this sort of like that confidence in your skill set, which I appreciate, right? I think that we as professionals do need to present confidently in areas in which we are confident. But if you don't know the answer, you need to confidently say, I don't know.
Yes. Yes. And when you know your stuff, when you actually really know it actually is so much easier to say, I don't know.
Well, and it's a lot easier to trust too, right? I trust someone who knows the bounds of their knowledge. And so if you're not showing me where the bounds of your knowledge are, I can't actually build that trust, right? We're getting into, I like The Science of Trust by Gottman. It's a tough read, but like, I really appreciate it because like, it's in those like little moments of saying, gosh, like, I don't know the answer to that.
Yes. I think too, we're coming from an era where doctor, professional, like it had such a like a high degree of authority. You know, if you were a doctor, your answer was like, that was the gold standard answer.
Yeah.
And for whatever reason, I'm sure somebody with more understanding of social cycles and whatnot could explain this better than I, but I think we're in a phase now where authority is kind of looked down upon. We're more in like this kind of, we're all on the same level playing field. And so I like what you're saying about, you know, be confident where you are confident. I think that's really important, but you don't have to be this all-knowing person because we actually don't really even respect that much anymore the way we used to.
Absolutely.
And I think that's okay.
Yeah, just that. And again, like the part of the conversation that I've had with my mom is she's like, well, we were just always taught to listen to the doctor. And I'm like, yeah, you can listen to them. Does that mean you trust them? Like listening to me is about respect. Like, but that doesn't mean anything about trust. It could, but no one is going to advocate for you. Like that's I think a really hard lesson to hear. And so a lot of folks, a lot of the people that I work with, they're like, well, I don't want to seem like I'm this. And I'm like, I appreciate that. I do. And that may certainly happen if you do that. However, like, you can also like not go back to them, which very unfortunately looks like doctor shopping. But I'm like, is it doctor shopping or is it like actually advocating for your health?
I think too, not to go down the rabbit hole too far of like social issues, but in the past, women and people of color did not have voices.
Yep.
And so if you went to the doctor as a woman, like it wasn't just about them being a doctor, it was also about them being a man.
Yes.
And so you didn't question, questioning meant you were not trusting, and you were supposed to trust. And I think now we're actually a lot of societally, I think we're all learning to try to trust ourselves more.
Yeah.
And
Well,
interesting. Go ahead.
absolutely. Well, and if you think about the very nature of chronic illness or chronic pain, that's about the betrayal of the body, right? And we're starting to like learn to trust the body again, just as we are like the people around us. Very unfortunately, because no one in the society escapes ableism, racism, sexism. Like we're all affected, and we've all internalized some messages of that just by nature of being in this society, some more than others. And then and so I really want to separate the difference between the what we're using for that word trust. I can't trust someone that I just met. And I mean like a doctor that
Yes.
you literally walked in 5 minutes ago. There is no way that I should or can trust you at this point in time.
Yep.
And so how do we build trust? And that's not about disrespect. Like
It's about relationships.
right? It's got to be like two. I can't trust someone who's disrespectful, but I can't, necessarily, I cannot trust someone and be respectful. It's one of
Yeah.
like weird paradoxes where it's like an orange is an orange, but not all things that are orange are oranges.
Yeah, absolutely. It, and if you're, I think too, I use the Enneagram a lot in my work, and I think it helps me understand like certain people are going to be more trusting of authority than others. And so
Yep.
if you are a person that highly trusts authority, you might go into your doctor's office with a lot of trust, whether they have earned it or not. And
Yep.
if that is helpful to you, then great. Because again, the trust in the relationship is what's going to ultimately be what gets you the best results. So,
Mhm.
Unless of course someone's doing harm, but
Right. Yeah, I was like, and evidence-based practice.
Yeah, there's of course, right. There's that. But yeah, and then if you're the type of person that needs to build trust and relationship, I think back in the day, there was like one doctor for the whole town, and they knew everyone in the town. And so, yes, maybe there was some of that also, like man, woman, like authority kind of thing going on. But also, I think when you are the doctor and you've been around for 20 years and you were their pediatrician, and now you're also their doctor as a 20-year-old, like
Yeah.
that trust was built.
Yeah.
And yeah, so building trust with our doctors now, I think we're all still trying to figure out, how do we do that? Everyone's a
Yeah.
specialist. You go to a different doctor for a different part of the body,
Yeah.
and they all have different opinions. So we have no choice but to learn how to trust ourselves and listen to ourselves and figure out what feels good and what doesn't, because they literally cannot do that for us anymore.
Yeah, absolutely. And this isn't to like bash like doctors. Like I don't believe that most of them are like ill-intentioned. I do think statistically speaking, there's got to be a few that are. Like
Yeah.
just statistically speaking, there's got to
In
be
any
like
profession.
in any
Yeah.
profession, therapists included. I'll talk about therapists later. They're just as bad. So like I say that with love. The yeah, it's and again, there's that sort of like issue with like using that sort of small town example. That means we also get to see the whole picture of them too, right? And so that means that that trust is built two ways. And because of the way that our health system works, and because of the way that agency systems work, the system that I worked for was for profit. It's a big Fortune 500 company, like for profit. And so like those systems work a little bit differently, and they're going to be about efficiency. So it's not just about like the individual doctor. We are talking about like systems upon systems that have created this, not the individual. And so when you've got 9 minutes to see a client, or your admin team is going to be on you because you're not seeing enough patients in a day, because the billing can't get done and the billing's not being accepted. Like this is not like an individual issue. This is like a systems issue that's happening within our healthcare system. But because we have that sort of reverence for the doctor, they're sort of the head, they're the face of the systems, but that's not usually the person that's got a lot of the power to make these changes. They're not usually the CEO. They're not usually that C-suite level being able to do that. And so, yeah, so I don't want to sound like I'm bashing them too hard. I'm bashing a little lightly, a light bashing.
We're all a part of this system. Yeah.
We are all a part of it. We've all, and I've certainly been guilty of it too, working in the system, not explaining things well enough, being annoyed with patients and not explaining well enough. I've done it. I'm not perfect, and yet we need to do better.
Yeah, I agree. Yeah, I think that's a part of it is learning to talk about where we have figured out how we can do differently, and then helping others do differently, understanding too that there is a system at play, and it's not just about individual work, but unfortunately sometimes that's all you have control over, and you do have to figure out what you can do within that paradigm.
Yeah, well, right, that's back to that burnout question. His name is Gentry. I can't think of his first name right now, but he had a burnout course out a while ago, years ago. And I loved his formula. His formula for burnout was perceived demands is greater than perceived resources equals burnout. And I love that because I like formulas. That's just how my brain works. But because we can sort of toggle that formula, right? So when we've got this perceived demand, which in these big healthcare systems we do, that's a lot of demand. That's a lot of like being available. Now we have portals. And so now they've got to like answer portal messages, which, love and hate. And then you don't feel like you have enough like perceived resources equals burnout. Same thing with chronic illness. We can use that same resource, like the perceived demand, being able to function through my day versus the resources that I think I have or don't have, leads to also that burnout, that same sort of thing. And the WHO put burnout as a diagnosis like 3 years ago now. And so, when we're thinking about those systems that are hard to change, those systems can also be contributing to burnout. And a lot of times they try to make that an individual issue versus a systems issue. They're like, go get a massage. Like, come on. Really?
Yep.
I mean, I'll take a massage because
please give me the massage. And also
and that's not going to be enough for burnout because we're talking about these big systems.
Yeah.
Right? The same as the body.
Plus,
it's multiple levels.
Yeah. It's hard to advocate for yourself in these systems, which I think is why a lot of people are moving into, entrepreneurism and freelancing, and which brings its own set of like issues with it.
Yep.
But
Yep.
It's complicated.
It's so complicated. Yeah, that leads into the kind of the work that I'm wanting to do now, or kind of next, is to really help therapists who are short on time and energy manage their practice, because we're all kind of getting that feedback, you on your practice. So like, how much demand there is and stuff. And I'm like, I've got this sort of like great way of being able to figure out how to do it like the most energy efficient possible, because not realizing that I had chronic pain and chronic illness for 20 something years, one of the benefits of it was that I got really efficient because I could never predict my pain level and I would still have to get things done. So I'm like trying to use this sort of like superpower that developed over the years to help other clinicians be able to figure out like how to do that, because these systems are so big. And if we try to change this big, slow moving system, we're going to burn out.
Yeah.
So let's focus on building your practice like the way, and helping clinicians do that so that they can better serve their patients and better serve themselves. Because what's the point of being your own business owner when your business is now running you into the ground?
Yeah. What would you say would be some of the ways that you help clinicians from either from it, maybe an example for each, an individual perspective, a systems perspective, and I feel like there's a third, but it's not coming to me right now. Yeah.
I think a part for clinicians as an individual, I really would do that acceptance piece. Because if we wake up in the day, in the, the beginning of the day, and we're like, oh, this is going to be like a flare day, oftentimes that sort of like internal logic there is like, I can't do this. Why did I think I could? It's not usually like great, like my body is doing this, all of those types of things. It's really about coming in and accepting like, oh, today is a flare day, so I have low spoons, and adjust accordingly. So starting with that acceptance. And like I said, we can be as angry about it as we want to be, but we're not going to doubt your skill based on something that you can't control. And so I like spoon theory. I've kind of taken it to be, I'm a bit of a nerd, so I take a bit more of like a roll of the dice because you can't predict it. And so I'm like, if you just like rolled a 1, like we got to
I
accept that
like that.
you rolled a 1, and then you plan accordingly. And again, like we can be mad about it, we can be disappointed about it. Those are all valid. Yet we still have that 1, and you have to divide your resources accordingly.
I like what you said. I see a lot in therapy. I'm in some like therapist chronic illness Facebook groups, and I do see a lot like questioning their skill as a therapist because they can't handle the demands of that one day.
Yep.
And I really hope I know therapists listen to this podcast too. And this is a really important message just because I see this so often. So maybe we can talk a little bit more about that. It might sound unfair at first to say, you just have to divide your resources and kind of like figure out what's most important. But at the end of the day, that is all we can do.
Yeah.
And if you try to have a whole day of sessions and it's going to leave you feeling like a terrible therapist, which spirals into, I'm bad at my job. Is this career right for me? It's like, why don't we just let one day go?
Yeah.
Rest, do what we have to do, sacrifice in that way.
Yeah.
And keep your confidence about you as a therapist intact.
Yeah, absolutely. Like, I think that, well, as pessimistic as I am, like I'm very pessimistic, everyone knows this, as all of us pessimists like to say, we're just realists. We're not really pessimistic. Like
Totally.
the chances of you rolling a 1 day is like guaranteed. Like,
oh yeah.
So, right. So it's like going
For sure.
to happen. So we want to be able to do that. And then again, like I'm okay if we want to be disappointed or hurt. It's not fair. Absolutely right. And yet, and here we are. And I also think I'm very high on patient care. Like everyone knows that I'm always thinking of like patients first. And so there's like, that's just part of our job as therapists, that we unfortunately have to put patient care sometimes above ourselves, not always. And so I do believe that there are ways that we can set up a practice to best serve them and best serve us. So when thankfully, I'm very lucky, my mobility is not impacted much anymore. It happens. So, but when my mobility was impaired, I had a conversation with my patients. I was like, listen, I just sometimes can't physically make it to the office today. So I may have to thankfully, I've always been able to do virtual work, and that's helped with the pain, because if I'm thinking and talking, I can't feel it. That doesn't work for everyone. That worked for me. Okay. So I don't necessarily recommend that, but that's a case by case basis. And so they were like, yeah, like that's totally fine. And so that was a conversation that I had ahead of time with people. And I don't think I had anyone where that was a problem. I'm sure there would be, statistically speaking, someone that has a problem with it, but you can have that conversation ahead of time. So that's another, I think there's a way around it. If we can just accept that it's at a 1, if we spend our time thinking and comparing about how we are to another clinician, like that's using that one in a way that's not going to be helpful. Let's use that one in a way that will be helpful. Do we need to see less patients more frequently? How do you want, like, there's lots of different ways that we can do that. And so, and again, with patient care, because we are providers, we need to really think about the patient. And then very unfortunately, for those of us that are spoonies too, we have to like see how that impacts it and how can we get around it, because, the days of Sigmund Freud are gone. They don't always have to lay on your couch 1 hour a week and talk about their mothers
3 times a week.
3 times a week. Right?
Yeah.
Like, there is a way. And the beauty of that is that the way that works for you as a clinician will benefit someone. So it will benefit the right patient for you.
Yes.
And
yes.
that's what we've got to, that's what we want to connect with, that if you're needing to do this, someone out there in the world is needing to do that. Sorry, in the state of Georgia, legally speaking.
It depends on where you're licensed. I actually,
Right.
I had someone email me from Switzerland the other day that listens to the podcast. So
I love it.
All over the world.
Yeah, all over the world. So depending where you're licensed, there's going to be someone that needs the way that you work with them. So I really encourage people, if you get to know what you need, then we can adequately provide the clients for what they need, which to me is like win-win.
Yeah.
Like, great.
It leads down a conversation about values and understanding what your priorities are based on how you want to show up and live your life. And so, when we wake up we've rolled the dice and it's a 1. And I love the dice analogy. I know all about the spoon, but I don't really use it like spoonie the word or anything.
Yeah.
So I love the dice analogy.
Call
and so
dices.
Dices. That's great. I love that. So if you wake up with a 1 and you know exactly what your priorities are, it doesn't mean the ball isn't going to be dropped in other things that are important to you.
Yeah.
The ball will be dropped. It has to be, so that you can. And so I agree. Like, so as a therapist, patient care, client care is my top priority.
Yep.
And so when I wake up and I have, 1 or 2, and I tend to not have 5 clients in one day, but Wednesdays, I usually just Wednesdays.
Right.
And that's one of my ways of maintaining self-care is I don't typically see more than 3, and never more than 3 in a row.
Yep.
And so that is so I can be a better therapist for that 4th person in the day. And on that day though, on Wednesdays, I know that my house is not getting cleaned. I'm not and during my break between the 2 and the 3 that I see, I'm just playing with my kid because that's my other priority. She's 10 months.
That's a great age. So gooey at that age.
I know she is. Yeah. She just started walking. So she's a moving gooey.
Moving goo mellow.
Yeah.
Love
but
it.
So those are my priorities. I have lots and lots of other things. I've got the podcast, I've got so many things, and I wish I could get them all done in a day. But even people without chronic illness, if you are doing that much work in a day, you are absolutely overloading your adrenals with cortisol. So it's not healthy. It's not healthy.
No, it's not. I just had high cortisol levels too. They were like, "What? Are you stressed?" I was like, "I wasn't that time." But Lord, these labs probably look bad. They've gone back to normal. Cortisols can be weird, but absolutely. And very unfortunately, when we're talking about manage these illnesses, managing stress is not lip service. So people are always talking about managing stress in a way that's what I call fluffy. And I'm like, you're not really talking. I hate the term self-care, but when we're talking about self-care is that hard choice to say, I can't go do the things that I love in order to stay alive and healthy, to be able to do that longer. And so when people talk about self-care, and I like massages and manicures just like everyone else, that's not what I'm talking about. Self-care is really healthcare in the daily front. And so that means that I have to be able to like manage, certain things. I have to make sure like I'm in bed on time when I really just want to go binge the latest like Wednesday, the Netflix show. It's really good. Like
I'm not a TV person, so I always miss the
yeah,
references, but
love TV.
Wednesday sounds good. I will.
Yeah. TV and Pinterest are the two things that I do in flare ups. Like, love it.
Oh yeah, Pinterest.
Yeah. Oh, so great. So great. I have a meme board for chronic illness. It like survives me on my flares. I'm like, yep.
Oh, that's great.
Add to the flare board. So, yeah. So, it's really like hard. And so I get a little like irritated when people like sort of like talk about self-care and these like sort of things. And I'm like, I'm going to go here today. Like, that's a really like privileged position that you're speaking from. Like, I like have to do this because I have to do this to survive. Like, if I don't manage this, like, this is a problem. And so when we're talking about this for like therapists and how they practice, I'm like, we can't make that comparison to an able-bodied person. You cannot. And I would probably push to say, we're assuming that they're able-bodied and we don't really know what's going on behind the scenes. And so, that just to be able,
or how much help they have. Is their family in town? Does their mom take care of their kids? Do they have enough? Does their husband or does their partner make enough money to hire a nanny?
Absolutely. And if you follow like on those forums, you'll see like when people go in and ask the healthcare question, like I wouldn't be able to be in private practice if not for my spouse. I love my spouse, but I will tell him and anyone all day long, I married you for your insurance. So
like the actual marriage of it, right?
The actual marriage was for insurance.
Totally.
And so, again, I like to tell folks, you don't make that comparison. We don't know that about your clinical skills. So on those days you roll a 1, I know it's hard, but don't waste that energy on comparing it to someone else's practice when I guarantee we don't know the odds and ends. I have a very privileged look because I do a lot of consulting for therapists. So I know what's going on behind the scenes. Right. And I'm like, no one there is running a perfect practice. I can guarantee it.
Absolutely.
And so like, don't waste your 1 on that. Let's use your 1 to like do something that's going to be beneficial for your healthcare and your recovery. And we will figure out the rest when you have rolled a higher dice number or die.
Yeah.
Singular, plural?
I have no clue.
Don't know.
Yeah, I think that is a really important point. As a therapist, we get this insider look into everyone's life. And like, it's when I'm scrolling on Instagram, my guilty pleasure is like home decor and just styling your house. And man, if I made more than I make now, my house would look like an Instagram room, Instagram house. I just love it. But
one of my friends does a podcast. It's called It Didn't Break Me. And she like goes in, but one of the questions that she does at the end is what's a mess in your life right now? And I'm like looking at my room right now and I'm like, it does not look like a Pinterest room.
I love that question.
It's such a great question.
That's great.
She's great. Yeah. Her name's Bianca Hughes. She does she's here in Atlanta.
Okay.
I think Sandy Springs, Atlanta.
I'm going to have to look that one up. That's amazing. Yeah. What in your life is a mess right now? Oh,
yeah.
I've been trying to think of a question that I can ask all guests and it just nothing has like hit me yet. So, I mean, I'm not going to use her question, but it's like helping me think of what I want to ask. That's really great. Mm-hmm. And so when I'm scrolling now these days, I'm like, I don't just look at this beautiful home that somebody has posted. I'm like, 1, what does the other corners of that room look like? 2, how long did it take you? How much spoons, whether you have a chronic illness or not, how many spoons did it take you to curate that corner? And do I want to spend my time doing that?
Yep.
Some days the answer is yes. And that's a form of self-care. It's like, I just want to spend a weekend curating this corner in my home, and that's fine.
Yes.
But I'm not going to pretend that like cures my anxiety or my depression or my chronic illness or like that it makes life all better. It's just, this was just a hobby that I did for a weekend. It looks beautiful. I'm happy with it, but it doesn't make my life like inherently better.
No.
My energy is best spent on, again, client care, having fun
Yep.
with my daughter. And yeah.
Absolutely. And that 10-month-old is going to really get the hang of walking, and then we'll pull it down in 2.5 seconds in such the cutest way that you'll like scream and be like, oh, at the same time.
100%. She's been crawling since she was 4. So we've actually gotten quite 4
Oh my
months.
gosh. That is so early. I'm so sorry.
I know, that's always the answer, the
I'm
response
so
I get.
sorry.
Yes, I will take your empathy, your sympathy.
Walking early too. Like people like get so proud of their kids walking, and I'm like, no
I
frontal
know it.
lobe and walking. That sounds like an awful idea.
That is just it. Yeah, I cannot tell you how many pebbles of dog food I have taken out of this child's mouth
Oh yeah.
in the
Yeah.
last 6 months.
All of my kids love dog food. All of them. Love it.
Oh, anyway,
Yeah.
this has been so good, Jennifer. Is there anything else you want to share that you feel like listeners could leave with?
Yeah, I think I want to pop back because I don't think I answered the systems question too for therapists with chronic illness and like systems. I really want people to sort of like think about how they're interacting with the system. So my other specialty is I work with people who are perfectionist caretakers and people pleasers, PCPs. And so therapists tend to be in that column. So I say that lovingly. That's like we tend to be in that column too. So when you're in a system, my suspicion is that the expectations are unrealistic. And so really look at the expectations that you have set for yourself, and really look at the expectations that the organization or the system has set. And then answer the question. We sort of get this feedback like, I'm not meeting the expectation. Well, my first question is, are you? Because we tend to be perfectionists. We tend to be people pleasers. We tend to be caretakers. And so that typically means that we are setting higher expectations for ourselves. And our systems play into it too, meaning like healthcare systems, agency systems, we tend to take that a little bit higher. But I really want people to like challenge that. Is that the actual realistic expectation? Are you truly going to get fired if this doesn't happen? If yes, then do what you need to do. But I want people to like really answer that question, because good enough is good enough. It doesn't have to be perfect. It doesn't have to be right. And so like to really approach systems that way, because, the system's going to keep on systeming whether or not you're there. And that's a hard pill to swallow, because we want to think that we want to be integral in the system, but systems are going to survive. And so you very unfortunately have to look at that expectation first. One, is it realistic? And then two, is it compatible with your health situation? And so that's what I would tell people. So, acceptance for the individual, expectations for if you're in a system setting.
Yeah, I really, really love that, because I think a question to maybe that you could ask people to kind of help them reflect on that is, if you do overwork yourself day in and day night for the system, we already know what's going to happen to you, but are you actually going to be rewarded for this?
Right.
Like we all kind of, we all want to work hard and get the A+, but what happens when you've studied all night long and the test was literally designed for you to get a C+ or a B-?
Yes, absolutely. Like grades on tests don't matter, because you can never predict what the tester is doing. And so all you can do is just do the best that you can, and then to let go of the rest. And again, that's a hard one, because particularly for women, we've been sort of conditioned to please whoever. Like, that's typically a part of our upbringing, is to, do the right thing, be kind, smile, all of that. And so it's really another like sort of hoop that as women we have to jump through for that. And I want to challenge people to say, like, is it? And what cost? Because there's always a cost, right? Like it's always a cost. And so if you look at that and you say, yeah, I need that affirmation right now from someone else, and it's worth that cost to me, like, cool, keep it trucking. Always do you. but ask the question first. That's what I tell folks. Ask the question first. Whatever the answer is, we will accommodate. That's totally fine. You need to be like held up in high regard and people praise you. Like, okay, of course you need that. We all need that. That feels great.
Yep.
At the cost, because it always comes at a cost, and you got to choose that cost.
I love that. This is so good. Yeah, thank you so much for sharing all of that. So you have a CE that you present. Do you present that like at certain times? Can anybody sign up for this? How do people, therapists, find this?
We don't have the 2023 dates yet. So we are hoping, obviously, because we're both Spoonies, we would love to be able to have this recorded and stuff. We did it live the last time. We'll probably, as you know, we can't do ethics asynchronous. So I think what we'll probably do is to do an asynchronous portion and then offer the ethics portion live. So we don't have those dates yet. Okay. They'll be on my website as soon as I get them, which is www.therapist2therapist.com. I guess I don't even need to say the www anymore. That's like showing.
Nope. Therapist to therapist.
Therapist to therapist.com. I'm like, what's that social media platform?
Are you on social professionally?
I am. It's therapist to therapist library.com. Okay. I really just want to have lots and lots of resources for people, for therapists, for clinicians. My private practice is petrichorcounseling.com. So I see clients there. We're in a pause right now, but I do have a Spoonie support group.
Okay.
And so that will start back up again in February. And Great. So if anyone's interested in that. So if you're a clinician, want some support and some help, again, just short on time and energy, whatever that means for people. If that's chronic illness, great. If that's ADHD, great. If that's autism, great. Like whatever it is. And so that would be the therapist to therapist.com. And then, but if you're a client wanting to work on some help, it would be petrichorcounseling.com.
Great. That's awesome. Yeah, I'll link those in the show notes. And then I also, I'm not sure if you've seen my emails, but I have a free consult group for therapists.
Yes.
So therapists who are listening. Yeah. And it's not just for Georgia therapists. So if you're listening and you just want either to come once and consult, maybe you're just a therapist who you don't specialize, but maybe you just have like a client with chronic illness because 60% of the population has it.
Right.
So you're likely going to have a client with chronic illness. Please feel free to join that group. Just get on my email list. As a therapist, just email me, destiny@destinywinners.com, and I will get you on that email list. And I just send the Zoom link out every month. So you show up, don't show up, whatever feels helpful. So
that's awesome. And just for like Spoonie clinicians out there, like this is like a great way to consult, but also to like network, because I don't do things unless they serve two purposes. We don't have the time or energy for that. So like not only are you connecting and challenging the isolation with this consult group, but also you're networking and building up referral sources, and you're getting consultation, like so many good things about a consultation group. So thank you for offering that. That's fantastic.
Yes. And I debated, but I really, because I know some people are kind of, they have boundaries around like whether you're fully licensed or pre-licensed. Please, if you're pre-licensed or even an intern, you're welcome. We had an intern last month and she asked some really great questions, and the conversation was just great. So,
I love it. I love it. I supervise a lot. It's one of my favorite things to do. So I used to do it at the hospital when they were still getting their master's. And then also like outside of it, it's like, I love it. I'm so passionate about new clinicians, but you're right. Like, I'm like, they're bringing all of this book knowledge. Like I graduated in 2007. Like, I don't know these new theories. You bring me the book knowledge, I'll give you the stuff that unfortunately you can't learn from books. It's the perfect trade-off.
And let's be real, they bring us the social media knowledge too.
I know, right? Because I can't do it. I'm still over here like www. I need my supervisees to correct me on that.
I love that. No. Oh my gosh.
Absolutely. That's awesome.
This has been so wonderful, Jennifer. Thank you so much.
Yeah, thanks so much for doing this. It was so great finding your podcast and listening to it and being able to just connect asynchronously with other clinicians who have to also deal with chronic illness. So thank you for what you do and put out there.
Yeah, thank you.
If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need in order to better absorb the same lesson. Lastly, leaving a review really helps others find this podcast, so please do so if you found this episode helpful.